Diagnostic Imaging and Health Through Awareness webinar. My name is Leisha Getson, and I will be your host. Before we begin, just a little housekeeping. The presentation this evening will last about 50 to 60 minutes, followed by Q&A. You should be able to hear me as well as the speaker and follow along with the PowerPoint presentation that's on the screen. To the right of your screen, you'll see a little chat box. If you have a question, just type it in and submit it, and we'll get to as many questions as possible at the end of the presentation. If we don't get to your question, you can forward it to me in an email at tdi@comcast.net, and I'll, with our speaker's permission, forward it to her to get you an answer. If for some reason you get cut off during the webinar, you may be able to log back in and fast forward to catch up. But if not, don't worry. This presentation will be archived on our website within a day or two, and the PowerPoint will also be available. Okay, so I'm very excited to introduce our presenter this evening. I had the pleasure of meeting her and hearing about the work that she's doing in the world, and I just thought it was fascinating, something I had never heard of, and I was very happy when she decided to become one of our presenters. So our speaker this evening is Deb Freeman, an EGASQ University Certified Postural Alignment Specialist. Tonight she'll be discussing eliminating chronic and recurrent pain with posture therapy. Posture therapy is a non-medical modality which utilizes a series of gentle, individualized exercises and stretches to target the underlying root cause of pain. Our speaker, Deb, received her Postural Alignment Specialist certification in 2013, at which time she began assisting others in their journey to eliminate chronic pain. In 2014, she obtained her Postural Alignment Specialist 2 certification. And so Deb also facilitates weekly postural alignment classes, I believe in Cherry Hill, but I'm sure we'll get some information about that. And she also does one-on-one sessions. So Deb, welcome. We're so happy to have you with us this evening.
Thank you, Leisha. It's great to be here. I'm very excited and grateful to share with you today how you can begin to eliminate your chronic and recurrent musculoskeletal pain and get back to living a pain-free lifestyle. So today, we're going to start with Pete Egoscue's story, the founder of the Egoscue method of posture therapy. And then next, I'll share a bit about my story and how I came to be certified through Egoscue University as a posture alignment specialist. We'll discuss what posture therapy is and talk about what your pains and physical limitations are trying to tell you. We'll have a look at some before and after photos of people just like you that are enjoying the benefits of posture therapy. We'll also spend some time experiencing a few of the balancing exercises, we call them E-sizes, and seeing how they affect your body. And lastly, we'll discuss where to go from here to begin your journey to a pain-free lifestyle.
Sounds great.
All right, so Pete Egoscue was wounded while serving in Vietnam. He developed hip pain as a result of the injury, but after his rehabilitation, the hip pain persisted. He was told by his doctors that the pain was all in his head. But he didn't buy it. He noticed that one of his feet was turned out, and he recalled that that wasn't the case prior to the injury. So he decided to take a look at an anatomy book, and what he saw was that the human body was designed in such a way that the feet are supposed to be pointed straight ahead and parallel to one another. So he thought if he could get his foot pointed straight ahead again, maybe his hip pain would go away. He began working with his body, doing stretches and exercises, and it turns out he was right. Once his foot was again pointed straight ahead, his hip pain went away. He realized that the pain was simply a symptom of his postural misalignment, and that his turned out foot was a sign that he was posturally out of balance. Once his balance was restored, he was pain-free. From there, he changed careers and ultimately went on to develop the Egoscue method of posture therapy. His efforts have since helped thousands to eliminate their chronic and recurrent pains, often when all else failed.
Wow, that's pretty impressive.
Yeah. So I'm here today with you because of my own chronic pain of several years. And ever since I was a teen who preferred good books over sports, I've had a less than ideal posture. As an adult, I had a career that required a lot of sitting and computer work. And yet I had no pain of any significance until I was in a car accident that left me with herniated and bulging discs in my neck. So I began treatment for my pain with chiropractic care and physical therapy. And the chiropractic care seemed to be somewhat helpful, at least temporarily, but my body wouldn't hold the adjustments. Now, unfortunately, physical therapy had me doing exercises that worked directly on the side of the pain, leaving me with even more pain and inflammation than I had before the therapy. I was then sent to pain management, and as you can see from the list here, I tried many modalities. Some temporarily alleviated my pain, but none of them really got to the root of the problem that was creating so much pain. So over the years, the pain spread from my neck, shoulders, and upper back to my whole body, to the point that one of my doctors mentioned fibromyalgia. Well, I was unwilling to accept that diagnosis, and pain management wasn't working, so my doctor sent me to a neurosurgeon. I knew I had the herniated and bulging discs in my neck, as well as arthritis, and had heard that surgery might help. At that time, I was willing to do anything if it would alleviate my pain.
Even surgery?
Even surgery, yes.
Wow. Okay.
I was desperate, in a lot of pain. It was affecting my life. So the neurosurgeon told me surgery wasn't an option. What he said was that I would be back every 10 years for another surgery, and at my age, that didn't make sense. What that told me was that the surgery wasn't actually going to fix the problem if I had to come back every 10 years.
Every 10 years, right, yeah.
Yeah, so the only option he gave me was pain management the rest of my life. Although he did mention that I had terrible posture after making me wait for 3 hours to see him, he never told me that there was actually something I could do about it other than simply trying to force myself to stand or sit in a particular way. And that was something I just didn't have the ability to do for any length of time. So I left the neurosurgeon's office extremely discouraged, yet not willing to give up and live the rest of my life in pain. All of the hope I had in my doctors were pretty much dashed, but that loss of hope was actually the seed of a new beginning for me. I decided there must be something that I could do, and I went in search of it. After much research and some trial and error, I found what I had been searching for. Something I could do that would change my posture and eliminate my pain. It wasn't a magic bullet, and I'm not even fully pain-free yet, but I've eliminated the majority of my chronic pain, and I continue to improve as my posture gets closer and closer to its blueprint design. It's taken some work and a lot of dedication on my part, but in the words of Pete Egoscue, I never said it would be easy. I said it would be worth it.
I love that.
Yeah, and so it has. In fact, it was so effective, even early on, that I decided to become certified as a posture alignment specialist and leave my career as a loan officer to help others like myself find hope and healing through posture therapy.
Wow, that's powerful.
Yeah, so here on the screen is a list of some of the symptoms of dysfunctions brought on by lack of motion or inadequate motion. So you may notice, and some of these, they may be things that if you're listening to this, you probably have some kind of pain, and you can probably relate to some, if not many of them. So the approach is basically the human body made simple. We have 8 load-bearing joints, and we're going to talk a little bit more about those very shortly. So it's also about changing your mind. Instead of asking what's wrong with me, ask what's my body trying to tell me. So if your feet aren't pointed straight ahead, for instance, maybe that's what's causing your hip pain, or maybe even your neck pain. And trust your instincts. You know more about your body than anybody else, including doctors and including me. We all know more about our bodies. We know what's going on and we know what we're feeling. And I would say if you're in pain, it's not all in your head. So remember, doctors told Pete his pain was all in his head, but he proved that wasn't the case. It was just a symptom of postural misalignment.
Wow. When your doctor told you that you had poor posture, the neurosurgeon, right?
Yes.
Was that the thing that stuck with you, that kept you saying, was it in the back of your mind saying, let me investigate that? Is that what sent you on your journey?
Actually, no. It struck me, what I thought was, well, you made me sit in a horrible chair and wait for you for 3 hours on a lunch break where I have to go back to work and work extra time to make up for it.
Right.
I'm in pain and I'm exhausted. I was kind of frustrated and upset at him. But looking back, when I found this, it all made sense. It all became clear. I was simply searching for anything that could help with neck and back pain. So
yeah,
I didn't realize at the time, I didn't realize there was something you could do to correct your posture aside from just trying to force it, do it by thinking of it all the time.
Chiropractic is what I would think of.
Right. Unfortunately, with chiropractic, if your muscles are chronically out of balance, they come back out. So you go to the chiropractor, some people, it pulls right back out before you get home. Yeah. Others, maybe it lasts a week, and others, it may take a month. So for those who it's not working for, and chiropractic is great, it may be that their muscles are so out of balance that that's just not allowing it to hold.
Yeah, makes sense.
Yeah. All right. So good posture is muscular and skeletal balance. This is pretty much what it comes down to. And posture affects many, many things. You'll see the list here, but it definitely affects your health, your overall health. It affects your musculoskeletal system, affects every other system in your body. And it even affects how people perceive you and how you perceive yourself. And there's a lot more coming to light these days about this aspect of it. Many of you may have heard of Amy Cuddy, and she talks about the research of how just changing your posture and doing power poses for 2 minutes can increase your confidence in yourself and others' perception of their confidence in you. So if you can just power pose for 2 minutes, imagine if you can really truly just change your posture, what that can do for you. So we want to ask what's different from what we were designed to be. So here is a look at the guy in the anatomy book. So all of you have either seen an anatomy book or in a doctor's office or a chiropractor's office or even a massage, going to get a massage. You've probably seen a poster with a guy that looks like this, right? So you'll notice that his head is centered on the plumb line. His shoulders and pelvis are level. His knees and feet are pointed straight ahead. And also I'll point out that you can see the thumb and forefinger of his hands, but not the backs of his hands. Many, many people have rounded shoulders, and we can see that by seeing the backs of their hands when they're facing us.
Interesting.
So have a look at this gentleman. He, as you can imagine, is in pain. You can see he's not lined up on the plumb line. He's very out of balance, and that, of course, is resulting in pain for him. Now here is a picture of him after some posture therapy, and you can see that it's much, much improved. His feet are still somewhat everted, and he's not exactly symmetrical, but he's come a long way, and so has his pain symptoms.
Wow.
And then we go to the side view here, and the plumb line we place just before the ankle bone. So it goes up through the body, and it should go through the posterior of the ear, the middle of the shoulder, the middle of the hip, the knee joint, all the way down. And there's a balance to the front and back, a little different than side to side. It's called dynamic tension when it's the front to the back. And you'll notice also this S curve, the spine there. That's the natural way that our spine should be for optimal performance and to not have pain, to have the best range of motion. And if you're lined up like the guy in the anatomy book, your spine is going to have that S curve. As our load joints, our 8 load joints, the shoulders, the hips, the knees, and the ankle start getting out of alignment because of muscular imbalances, our S curve can be pulled out and it can go into a C curve or a J. We lose the integrity of our spine. All right, so we're back to the same gentleman, and you can see that he's pretty much a C curve. His spine, he's lost his S curve.
So he's kind of going forward a little bit, like his shoulders are going forward.
Yeah, if you look, let's show you the after here. Do you see how in his lumbar spine there's a nice curve in, and then there's a curve out, and then another curve in his neck. And if we go back to the first, he's losing that S curve. There's very little in his lumbar spine.
Yeah.
And he still has a bit in his neck, but he's losing part of that curve, and eventually he could be totally hunched over if he keeps going.
Yes.
And we've all seen that.
Yeah.
Yeah, and it's
so much of that now. So
yeah, much. and it's very painful.
Yeah.
So as you can see, posture therapy is helping to straighten them out, literally.
Yeah, right. Wow.
Okay, so it's about cause versus symptom posture therapy. Okay, so the site of the pain is rarely the source of the pain with chronic and recurrent pain. So unlike acute pain, such as you hit your thumb with a hammer, the site of the pain is the source of the pain. You know what to do, you know what caused it, you know what happened, and you can address the pain. But with chronic and recurrent pain, seldom is the site of the pain the source of the pain. So take my neck pain, for example. Even with a diagnosis of a herniated and bulging discs and a precipitating incident, the car accident, the source of my pain was not in my neck, but in my pelvis and shoulders, which is why my doing the physical therapy exercises increased my pain and limitations when they had me stretch my neck, and why posture therapy worked by addressing my body as a unit. So that's the second thing. We believe the body is a unit.
Okay.
Anything in the body that is out of alignment will affect the rest of the body. So if you look to the right here at our little stick guy, if there's a dysfunction in the ankle, the weak ankle, something happened to the ankle and the integrity of the ankle, it's out of alignment, you can have pain anywhere else in the body. I have someone that I worked with that had neck pain, a lot of neck pain, hard to sleep because of an ankle injury. And after just a few classes, she could sleep with no neck pain.
Wow.
So yeah, it's pretty great. The body's pretty amazing how quickly it responds to stimulus, whether that's good or bad. So we want to start asking more questions. Why is this going on? What's this pain mean? Not just silencing it. With pain meds are great to an extent, but we all know what's happening with pain meds and the concern of taking them long term.
Right. Yeah.
So we ask what our body's trying to tell us. And with posture therapy, we can really look at the body and see, not only just know what the pains or the diagnosis is, but see what's going on in the body. Well, your feet are turned out. Well, there's a reason for that. Muscles are bringing it there. So that leads us to the last point, that bones do what muscles tell them to do. Okay, so our muscles are they're in control. And if we can change our muscle memory, which is what we do with the posture therapy, then those muscles we can bring those into balance through simple, gentle exercises and stretches, and once those are in balance, it just pulls everything else into where they're supposed to be.
Mm-hmm. Makes sense.
Okay, so poor posture equals poor function. So this guy, a lot of people would look at him and think he's pretty fit.
Mm-hmm.
Well, what we see upon further inspection is that his feet are turned out, or what we call everted, one more than the other. They're in different places. His knees, there's a little hard to see, but they're turned out as well. They're not facing straight ahead as they should be. And he has rounded shoulders, which we can see because we see the backs of his hands.
Oh, yes.
Yeah.
Oh,
yeah. So his body's talking to us and his body's saying, but many of us don't know this. I did not know this before I came across Egoscue. So these are things that we can look at and we can make changes to improve his posture, thus making him less prone to injury, pains, limitations, making him more healthy and functional in all the systems of his body. Because remember, the body's a unit and one system affects another, for better or worse.
Right.
So what we want to do, see, if this guy goes out and he wants to hit a golf ball or, I don't know, chop some wood or go for a run, whatever the activity he wants to do is, he is already set up to potentially hurt himself, to get some pain or injury. So what we want to do is to fix the body going into the activity versus activity avoidance. Okay, so what happens is we start to get pains and we start limiting what we do. You know, I can't do that anymore, or I knew I shouldn't have done that. You know, we hear that all the time. But what if we could fix the body so that we could do whatever we want without pain or the fear of pain? And that's what we're shooting for. So unfortunately, we're experiencing compromised posture and pain and physical limitations at a younger and younger age than ever before. Unfortunately, without intervention, this child will experience more and more pain, symptoms, and physical limitations. But good for him, his parents took him to a clinic and he receives care.
Wow.
So now is the fun time.
Okay.
So we're going to test it a little bit and we're going to experience just a few of the exercises. But I want to go over a few things first. First, listen to your body. Okay, if you're listening to this, you probably have some kind of pain or limitation. Really listen to your body. If your body tells you, you know, you shouldn't be doing this, or if it's aggravating a chronic or recurrent pain, please stop. Okay, we don't want to force our bodies to do anything that they're not able to do at this time. And it's counterproductive to healing your body and getting rid of pain. So only take what your body is willing to give at this time. And these are just an example of what some of the exercises can do and may not be the stimulus your body wants or needs at this time. Okay, so if you have, like I had, upper neck, upper body pain, these might not feel great to you. So please don't take the whole of the method from these. They're just really a few really great exercises that, though we're working the upper body, they actually balance the whole body. And we're going to have a look at that and see what they do to our body. So first thing that I want you to do, if you feel like you can try these, is to stand up and stand in a comfortable position, preferably with your eyes shut. Now, if you are uncomfortable shutting your eyes, feel free to leave them open. But just for this is not for the exercise, just for the balance test to see what you're noticing in your body before we go into the exercises. So you're standing, eyes shut if you're comfortable. And I want you to notice what your balance is like right now. Do you feel balanced?
I feel like I'm swaying a little bit.
Okay, and that's a normal thing that many will feel. And notice your feet. So is there more weight in one foot than the other? Now, notice where the weight is in your right foot. Is it more in the ball or the heel, more in the inside or the outside? And then go to your left foot. Notice the same thing. Is the weight more in the ball or the heel, the inside or the outside? Now, is that different left to right? And many people will notice a difference.
Yes,
Okay.
I have a difference.
Okay. So go on up and notice your ankles. How do they feel? Do you feel a difference? So some people may feel like, again, there's more weight into one, or maybe you feel like, one of them's kind of collapsing in, it's not as steady. But is there any difference? And then you can go on up to your knees and just feel those. Is there any difference left to right? Maybe you feel like your knees are flexed, or maybe they hyperextend and you can feel that. And then go on up to your hips. Now the hips, a lot of people, especially with their eyes closed and they're just focusing in on their body, they may notice that they can actually feel that one hip is higher or more forward than the other. So can you notice that? And maybe you don't notice that, but maybe you notice there's something different going on left to right. Maybe there's a little tightness or pain. Maybe it's just some kind of feeling and you're not sure what it is. So just take note of that. So going up to your shoulders and notice those, much like your hips. A lot of people will notice there's one higher feeling or more forward. And in this day and age, most people definitely notice a difference left to right. There's one side that something's different is going on from the other. So just notice that. What is it? How's it feel? Go on up and notice your neck and your head and how they feel today. What's going on? Maybe you have some neck pain, stiffness. Maybe you have a headache. Go on down to your low back. How's that feeling right now? Your mid back, your upper back. Notice your abdomen and your chest. Now, if I've been sitting a lot, even with doing these exercises for some time now, I feel pretty collapsed in my torso. If I've been sitting a lot, sitting at my computer, I haven't done my exercises. So notice, do you feel kind of collapsed in your posture? What does your torso feel like? Can you breathe well? What's your breathing like? Take a nice breath. What's it feel like? Okay. It's amazing what we notice when we stop and take a moment and shut our eyes. Okay, so I want you to just really notice what stands out the most to you right now. Remember everything, kind of how you felt. You're not going to be tested. If you forget, it's okay. But just kind of get a sense for what you're noticing, because we're going to come back to this after we do the next few exercises. Okay, so the first one is going to be standing arm circles. Now I'm going to walk you through how to do them. Don't start doing them yet. First and most important thing is your foot position. Okay, so now I'm going to ask you to stand with your feet hip width apart and toes pointed straight ahead. So I'm going to explain what that means. Your feet hip width apart should be the heels far enough apart that you could put about 2 of your fists between your heels, or a dollar bill. Okay, so maybe 6 inches between your heels. But then your toes, there should be about a fist width between those, only about a fist width. Your toes are going to look probably slightly pigeon-toed. So look at the girl in the picture, okay? See how her toes are pointed straight ahead. Also, you can look at your feet. If you're barefoot, that's great. If you're in shoes, that's fine. Hopefully not heels. Kick them off if you're in heels. Barefoot's great, or socks, but feet straight ahead is the second and third toes kind of parallel, or line between the second and third toes. So it may feel pigeon-toed. If this causes pain to put your feet straight ahead, put them as close to straight ahead as you can equally. Okay, don't let one of them turn out more than the other. Just do what you can. We'll work with what our body's willing to give. Okay, so the second thing is a hand position. And these are very important to, all these things are very important to the effectiveness, why this method's so effective. So we're going to take our hands, and I don't know how well you can tell from the screen there, but we're going to take our fingers to the pads of our palms, the tops of the pads of our palms. So it's like, not like you're having a fist. but just curling your fingers. You can see most of your palms, your thumbs are out. Then keep that hand position and the foot position. Put your arms at your sides. Bring your shoulder blades together and down your back. Okay, and hold them there, about 50% effort towards each other. Not going to hurt ourselves. And then you're going to lift your arms up, keeping those shoulder blades together and down. Lift your arms to about shoulder height. And we're going to start going up and forward in about 6-inch circles. So like a 6-inch dinner plate. And I'm going to count them for you. Okay, so we're going to do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Okay, if you can do it, stop, stay in the same position, take a breath, turn, keep in the same hand position, shoulders together, turn your palms up towards the ceiling, thumbs back, pointing backwards. Okay, now we're going to do 25 more going up and back. Same
and we're
thing.
Circling our hands here? Is that what we're doing?
We're circling our arms.
Okay.
Okay. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. All right, rest your arms down.
No, good.
They're hard, especially if you aren't used to doing a lot of arm exercises. They can be fatiguing. Again, stop if anything is too much. We don't want to push our bodies past what they really want to do right now. Okay, so what I'd like you to do is, if you have changed where you're standing in your foot position, go back to feet hip width apart, toes pointed straight ahead. We're going to do standing elbow curls. We're going to do 15 of them. Okay, and these look really easy. They're deceiving. So we're gonna, they're not easy for most people today, because we have a lot of thoracic rounding, a lot of tightness in our upper back and shoulders. So we're gonna do that same golfer's grip with the hands, bringing our fingers to the pads of the palm, thumbs out. Okay, and take a good look at the screen. So, because if you have glasses, you might want to flip them up on your head, or put them aside, or put them into your shirt, because you're going to put your first and second knuckle on your temples on each side, just like in the picture, thumbs down. Okay, and you're going to bring your elbows back as far as they can, shoulder blades together, and you're going to slowly bring your elbows towards each other without bending your wrists. That's very important. Don't bend your wrists. Only come as far as your most limited shoulder will allow you to go. Okay, you may not be able to touch elbows like the lady in the picture. Most people can't the first time they tried them. So we're going to go in and back out, in and out. Okay, we're going to go a bit slower than arm circles, because these tend to take a bit more. Yeah. Even though they look pretty
easy,
simple. They look like they would be a simple thing. They're not so simple for many, many people. It's an amazing exercise. The foot position in these, and I'm not counting anymore, so we're just going to do a hand. Okay, great. Thanks, Leisha. I love my counters. So having the foot position actually makes this a full body exercise. Doing this upper body work actually affects your ankles, your knees, your hips, everything, your whole spine, in a very positive way. So we're probably about at 15, I'm guessing.
A little bit more.
Okay. And we're going to go on to the last exercise, and then we're going to check back in. Okay. So again, feet hip width apart, toes pointed straight ahead. This is called standing overhead extension. Before we go into it, a couple of things. Keep your elbows very straight. Once you have to bend your elbows, you're not doing the exercise as intended anymore, and you're not going to be affecting the proper muscles. You may not be able to go up as far as this gentleman in the picture. That's okay. Go as far as you can comfortably and come out of it if it's creating any pain. Okay, so we're going to clasp our hands together, push our palms away from us, elbows really straight. We're going to lift them up above our head, okay, as far as we can go, ideally up to about where our ears are. If you can lift your head up and look up, great. If that hurts your neck, just look straight ahead, okay? We don't have to look up, okay? Relax your abs. Notice if they feel like they're pulling, if they're tight. We're going to just hold this. We're not moving in this. It's just, usually we spend about a minute in it. So I'm going to give you several more seconds to just breathe and relax and hopefully enjoy the stretch. For some people, it's a stretch to enjoy the stretch.
Yes. Oh, gotcha. Yeah, it feels good.
Okay, so go ahead and rest your arms back down at your sides. Just, I don't know, take a breath, relax, wiggle around if you need.
Yeah, I feel like I need to shake it out a little bit.
Yeah, it can make you feel a little stiff. So we're now, in just a moment, I want to point out a couple of things here, or a few things, but before we do the balance retest. Okay, so what I want you to do is, once we go into this, I want you to just walk in place and go back to a comfortable standing position. Don't place your feet like I had you do before. Just let your feet go where they want to go. We want to really just kind of look at, what did this do, these just few things do to our bodies, and how does that make us feel? So some people will notice they feel more balanced or grounded. Some people say they have less pain or stiffness. Some feel taller, more opened up. Some more relaxed, less tightness and tension, improved breathing, enhanced mood. And some people give me crazy descriptions that no one else does. So that's great. So go ahead and just, if you can, if you shut your eyes before, shut your eyes again, stand comfortably, take a breath and let it go. And notice, once again, what's your balance like? Did it change any? Notice your feet. Is there a difference, a change? Like if you were leaning more into one, are you more balanced left to right? Did where you're placing your weight in each foot, did that balance out any? Did it change? Notice your ankles, and did anything change there? Your knees, your hips, your shoulders. Notice your neck and your head, your torso, low back, mid back, upper back, abdomen, and chest. What was it that stood out to you before? What did you notice? And has anything changed? We basically provided a stimulus to our bodies. We put our body under a demand in a probably, most likely, more balanced, better aligned posture because of the foot position than our bodies are used to. So there's going to be some kind of response to that stimulus, most likely. And if there is, then you'll most likely notice something.
I feel more balanced and grounded.
Great.
My breathing is better.
Good. Awesome. Okay, so this is kind of an extreme example of someone who had one session, about 3 hours long, of posture therapy. As you can see in her after picture, she still doesn't have fabulous posture, but wow, what an improvement. Yeah. Wow. And she was ecstatic and thrilled.
Yes, I'll bet she was.
So that now, people who are that extreme, much, very quick changes, obviously, because there's such an extreme difference.
Well, for that lady, would that hold, like, if she continues to do the exercises?
It will, if she continues to do them. That is one of the keys to the success of this therapy, is we have to change the muscle memory. Okay, our bodies are the result of all the stimulus we provided it up to this point. So if we're in pain, it's because of the stimulus that we provided it. So adding in this new positive stimulus can actually change our muscle memory over time. Yeah. And it's quick results, but this would go away if she never did it again. She'd go back to the same thing, because that's what our body's used to. Okay. But as she continues to do it, there are changes, and they're
Yes.
going to stay as long as she continues to give it stimulus,
Mhm.
and it may be that she doesn't need as much of the posture therapy later on as she's more active and she can move around and she's living life,
Yeah,
versus.
well, with those sorts of results, why would she not want to continue, right? I mean,
Absolutely.
that's dramatic.
Absolutely. So the next is yours truly.
Oh, hello. Hello there.
Yeah. So you'll notice, and had I known at the time I took that first picture that I would be showing this to so many people, I would not have worn that bathing suit. But because I did, I kept it, and I actually still kind of fit into it, even though it's big and baggy. So I want to point out some things. Now this is extended time in posture therapy. Something's going on. Okay.
There you go. Good.
So now I want you to notice in the before picture there on your left, the vertical line, the plumb line. That is placed between the ankles, okay, when we do the posture photos. And it goes up the body, and it should dissect the body in half, left being equal to right. When you're a lot of people out of balance, are going to be to one side or another, something's going to be different left to right. I want you to notice that you can see a lot of the backs of my hands. That means I had rounded shoulders. And notice my knees and ankles, they are definitely not stacked under my hip joints,
Mm-hmm.
the bony
Right.
protrusion of the hip on the front.
Mm-hmm.
So a lot of people get that narrow stance, some a wide stance to kind of steady themselves. Notice, if you can see there on your screen, my right ankle. It looks like it's about to snap.
Mm-hmm. Yeah, it does.
It very unstable. Notice in the after picture. Now, I'm a work in progress for sure. I still have a ways to go, but my knees and ankles are in a better position. My ankle doesn't look like it's going to just snap. I'm still off a little. This was actually a while ago. I haven't taken new pictures in a while, but you can see there's some positive changes there. I want to go on. I guess I should point out, yes, I did lose weight, because that's what everybody says.
Okay.
And they always ask, well, was it this? I believe that it was yes and no. It was this because once my pain started going away, I stopped living my life sleeping, laying
Right.
around, conserving my movements, because everything, when I moved, it hurt. And I didn't eat to make myself feel better.
Mm-hmm.
I would do that some. I ate pretty good, but I didn't always make the best choices because I was in pain and I wanted to comfort myself. And I know there's a lot of people probably listening or that will hear this that can relate to that, because I've talked to a lot of people that do. So notice in the back picture, what I want to point out with this one is my shoulders. Look how much more relaxed my shoulders are in the after picture than in the before. Now, I had extreme neck in this first picture, neck, upper back, and shoulder pain. Pain everywhere, but that's where it was mostly. And as that has gone away, my body's just more relaxed. And, I didn't feel like my shoulders are all up in my neck.
Mm-hmm.
And from the side photo, you'll see again that there's a pretty good difference. I'm very forward of the line, my knees, my hips, my shoulders, my head. Still not perfect, but working on it every day.
Okay.
So working on getting all my load joints properly stacked, all the muscles balanced. And the great thing is that every time I do it, it makes me feel better. When I start to get stressed, or I've been sitting a lot and you feel that stress, and I know you all know what I'm talking about. I look forward to doing my exercises. It's kind of like when I'm hungry, I eat. When I'm thirsty, I drink. Well, I do some of my exercises, and it just makes me feel good.
Mm-hmm.
So this is one of my clients who, after 6 weeks, went from the first photo of being, you can see he's like rotated. You can see a lot of the front of his body.
It looks like he's ready to pitch forward and fall.
Mm-hmm. And, off of the plumb line. And then 6 weeks time doing his exercises. I believe I did them about 5 days a week. You can see he's much, he still has a way to go, but he's much better.
Looks much more stable.
Mm-hmm. Now this client, she, in the first photo, she was having a major back spasm and a lot of pain. She called me and said that she was going to a chiropractor. And so she called me when I talked her into coming back in, or into coming in to see me before she went to the chiropractor, just to get pictures. So the first picture is she came in before the chiropractor. She went to the chiropractor's office, went home, and she called me and said, it really didn't help much. I'm still in extreme pain. And I talked her into coming back in. And after a couple of hours, she walked out straighter than she had been in a long time in this after photo here.
Yeah.
That was pretty exciting.
Yeah.
So this client came in with sciatica and a herniated disc, amongst other things, some numbness and tingling and things going on down her leg and into her foot. And in 6 weeks' time, she went from extreme pain, barely being able to walk, to days with no pain or issues walking. In fact, when she first came, she wasn't even walking upstairs. She was living downstairs, wasn't even sleeping in her bedroom because going up and downstairs was just too much.
She looks young. I obviously I can't see her face, but
yeah, she's pretty young. So yeah, she actually had surgery for a herniated disc. Months later, it came back. The sciatica came back on the other side. She had surgery scheduled and canceled it to do the posture therapy. And she's coming along great. She's continuing to do her exercises. As we talked about, we can get you out quickly, get you out of pain quickly, but it will come back if you don't change your muscle memory, because your body will just go back to that same position. So it does take some time, but boy, is it worth it. So you can see in her after picture, she's much more aligned. Her feet aren't as turned out. She's, not leaning all the way into the one side.
Her hips look straighter.
Yes, she is a much happier camper, as you can see from her face. So
yeah.
This client came in with a degenerative hip and difficulty putting on her shoes and socks and walking, of course. You can see from her picture, she's quite off, much like the last one, very leaning to one side. And the after picture, she's much more balanced. She has, in just weeks of therapy, been able to, much less difficulty putting her shoes and socks on. She's like, oh, I can lift my leg. This is great. And she is determined not to have surgery. She's seen, as she's told me, she's seen what people who've had surgery, there's been a lot of bad outcomes, unfortunately. And so she's determined not to go that route. And she's doing great. So next, he came in with back pain, and he's had back pain since his teens. It began to limit his ability to do one of the things he loved so much, which was walking. He loved to walk like an hour at a time, and he was down to maybe walking 5 or 10 minutes before he had too much pain and he had to stop. So one of his goals was, I want to walk for an hour. I want to be able to walk without pain. And as you can see in his after picture, his posture is much improved. He's not so kind of bent over. And he was able to pretty quickly get back to walking like he wanted an hour. So
and is this in one session, Deb?
Some of them are in one session, some are not. Most, the one was in one session. Most of these are in a handful of sessions.
Okay.
Okay.
The sessions are lasting. I'm sure you'll get into that, so I don't want to jump ahead, but.
Yep.
Yeah.
Okay. So this client came in with multiple pain issues. And as you can see, much like myself, she not only eliminated much of her pains and, or you can imagine her pains, but her posture is better aligned. But she was also able to lose weight in the process. Now, she's been with me for a while, and she has found this to be so wonderful that she is currently going through certification to be a posture alignment specialist as well. So there's going to be someone else in the area in New Jersey as well. Let's see, next. So this client had pains, but her main reason for doing the posture therapy when she found out about it was to improve her posture. She's been told her whole life how her posture was, and she, could see how it was getting worse and not better. And she didn't know what to do about it. She just thought, well, I just try to stand good and whatever, but you forget about it. So she's thrilled that she has something that can actually affect her posture, and it has, as you can see. She's much less kind of collapsing in her body. She's also been able to get rid of pains, and that's been a plus, really a plus for her, not the main goal.
Big difference.
So this is a client that had an extreme case of scoliosis that wasn't responding well to chiropractic care. So in just 6 sessions, this is 6 sessions that you see here for her. She went from pain levels of like 8 and 9, pretty regular 8 and 9 pain levels, to a pain level of 2 in this last session here. Wow. She was thrilled. Okay, so I don't know if some people without a trained eye may not be able to tell the difference, but there's a big difference in her posture, in the curve of her spine. You can kind of look at the space between her arm, her left arm, and that has decreased. She's kind of lifting up. She thrilled. She did wonderful. She's pretty young, as you can tell, beautiful girl, and it's just been miraculous for her. So what exactly is posture therapy? Posture therapy is a process which involves a series of stretches and gentle exercises designed specifically for each client. This process strengthens specific muscles and brings the body back to its proper alignment and functioning the way it was designed, pain-free. So the steps of posture therapy. First, we rediscover the body's design. So remember the guy or the gal in the anatomy book, what we saw earlier. We know what our goal is. We want to have a certain look to our posture, and it's pretty easy to pinpoint that. And as we get closer and closer to that, that's when we begin to allow our bodies to function better. And throughout that process, it's restoring function. Okay, so these exercises and stretches, they restore function to our body. They get our body to start moving in ways it should be able to move, increases range of motion, and people start getting rid of their limitations as well as their pain. So, I can't get up and down off the floor anymore, or difficulty. I had the worst time getting up and down off the floor. That's how much pain I was in. Now I can get up and down without using my hands if I want.
Wow.
Yeah, so we restore function, so you don't have limitations. So, if you wanted to go out and, climb a tree like you did when you were a kid, assuming you did that, you could do that. Not that you would, but that you could if you wanted. But doing that is about, again, changing the muscle memory over time. It's about reprogramming. So we kind of have to incorporate it as a wonderful stimulus, a wonderful part of our life. Now, the body is able to heal once it's aligned as it was designed, and that's the return to health.
Right. Yeah.
So what's the next step? You can work with a postural alignment specialist like myself. There's in-person visits. There's also online therapy if, in-person's not conducive to, where you are. Maybe you're not very close to a specialist and it's hard to get out of your house. You could do it online. There's books. This is where I started. I highly recommend the book Pain Free by Pete Egoscue. That's my favorite book of his for anybody with chronic or recurrent pain. Your library probably has it. I know Burlington and Camden County libraries have this book. They have some of his books. They definitely have his pain-free book, but now everybody's going to run out and try to get it from the library, so there may be a wait. It's around $10 on Amazon, or you can get it at a local bookstore, but I think it runs about $17 at a local bookstore like Barnes & Noble.
And he explains, does he give illustrations in there of the exercises and things?
He does, of some of the exercises. It's an amazing book. I recommend it to anybody. I recommend it to the people who come to me, even for the therapy. And in fact, those who read the book are the best clients because they get it and it makes sense and they've done it and they want more. You know, the book Pain Free helps to mitigate your pain. It can help you get out of pain, but it may not take you there to where your posture is fully aligned. You may need more work for that. But definitely start out with the book. There's online resources. You can go to YouTube, plug in Egoscue exercises for back pain, neck pain, whatever your pain is, whatever your situation, sciatica, carpal tunnel syndrome, whatever the thing is, most likely something will pop up, maybe several, that'll give you like 3 exercises for low back pain. And try them out. They show you how to do them. They're short videos. It'll probably only take you 5-10 minutes tops. You can try them out and see, does this resonate with you? You know, is it something that makes you feel good? Is it something that you think you want to do? And then, of course, I hold local classes and workshops, primarily out of Yoga for Living in Cherry Hill. And I'll have more info on where you can go for information on that. I hold a Tuesday night class that regularly. I have a workshop actually coming up, 3-week series workshop for neck and shoulder pain, starting in about a month, end of March, last 2 Fridays of March, 1st of April. So you might want to check that out if you have neck and shoulder pain. So for more information about me and Aligned by Design, you can contact me by phone, which is listed here, or email. You can check out my website, or you can go to my Facebook page, and there's some information there. I typically post articles every once in a while. I'm not on there a lot, but there's some information on there, and so that's information about me. You can also get more information about posture therapy. I recommend you go to egoscue.com. They have a lot of great information on Egoscue's website. And there's a really great article that Dr. Axe has on his website. So there's a link there for that. If you're looking for a posture alignment specialist in your area, go to that link. It's on egoscue.com. You search for certified practitioners, plug in your state, and it'll pop up anybody that is in the area that meets the requirements to be listed on that website. Okay, and you'll find me on there. Also, for more information about the classes and workshops that I hold weekly at Yoga for Living, you can go to yogaforliving.net, and that link takes you straight to my page, Posture Alignment. And also, you can sign up with me by emailing me for email notification of any posture alignment classes or workshops in the South Jersey area. I don't do everything exclusively at Yoga for Living. Sometimes I have free ones at the libraries, Burlington and Camden County, you know, or just different, maybe another yoga studio, at a church, different places in the area. I don't send a lot of emails, so don't worry about that. I don't sell your email or give it to anyone. If you are interested just in classes or workshops, that's all I send out, so that you can go shoot me an email and I'll put you on my list. And lastly, I will send to you, if you email me, I will send you the 3 e-sizes we did today, the balancing e-sizes, the instructions, the pictures, and there's a video link as well, so that you know that you're doing them right. Okay, because you might not remember all the little details. So you just specify if you want to be added to my email list when you ask for them. If you don't specify, I'm going to add you to my list. So if you don't want to be on my list, say, please don't add me to the list, but please send me the exercises.
Okay, fair enough.
And I will do that. So I love Pete Egoscue's quotes. They're really great, and you could look them up. But I just wanted to give you a couple of them before we end. He says, pain is not a disease, not an injury, not even an effective aging. Pain is a symptom of postural imbalance. And until you recognize the need, the absolute requirement for taking responsibility, you will not succeed. Once you do accept the responsibility, however, the Egoscue method never fails. Never. No drugs, no surgery, no machines, no miracles, just you, a normal person doing normal things. That's what it's about. It's about, maybe you need to, the help of a posture alignment specialist for a while, but we do our best to equip our clients with the things they need so that ultimately they can, take care of themselves. We give you tools, and you know what works for you, and we help you to really get in tune with your body and listen to your body and what's it telling you, and what stimulus do you need when that back pain creeps in or that neck pain creeps in.
Right, yeah.
And so thank you, Leisha, TDI, for supporting holistic healthcare. And
my pleasure.
thank you so much for having me.
That was also my pleasure.
Yeah, and I will leave it up to you now.
Okay, so I just have a couple comments and questions on an initial consult. How much time should one allow? Does it vary client to client?
On an initial consult, okay, and that can depend on therapist to therapist as well.
Okay.
So, yes, it can depend on the client. With my initials, I usually really take my time and spend it with the client as long as they have the time to do it. If they don't have the time, I'm willing to, kind of pare it down and work with them. Always, whatever the client needs, that's what I'm going to go with. But most of my clients do not mind 3 hours for a first session. There's a lot to do. And, I like to take my time with the client and not feel like they're being rushed, and that we can really address everything and make sure that they're walking out feeling better and knowing what they need to do between the first session and the second.
Right. Okay. Yeah. And I love that, both of those quotes, but especially the second one, and just really this simplicity of this approach. Putting the body back into alignment and letting the body do what it does, giving it a chance to heal. And you gave us some great. I think walking through that exercise was fantastic, because you could see how your body responded to that.
Yes.
How challenging it was or not. And so, it was just great. Yeah.
I find that even I've done those in workshops, face to face, and almost every time, almost every person does notice a positive difference. Even if it hurt when they did it and they still did it and it was hurting, they came out and they're like, wow, I feel actually better.
Yeah. And that was the beauty of that. I mean, I didn't expect really to feel much of anything, but I did. And simple 3 little exercises. Yeah.
Yes. It's, I'm telling you, it's a life.
I'm a believer.
And actually a lifesaver in some cases. I've heard stories of people that said this was their last, nothing else worked. This was their last thing. One person said they couldn't even lift a spoon to feed themselves.
Wow.
They were going to actually end their life if it didn't work. And guess what? It worked. And she became certified as a posture alignment specialist and is now helping people.
Wow, that's powerful stuff.
Yeah.
That's really fantastic. I would imagine that this would be great for athletes to be able for you to be able to take a look at them, see where their weak spots are, and address them before they get hurt.
Yes, actually,
that would be invaluable.
It is great for athletes. In fact, Jack Nicklaus is one of Egoscue's biggest endorsers. Egoscue was able to get him. He was going to pull out of a tournament. I don't know when it was, but he was going to do a tournament, and he was in such pain. And Pete's like, "Wait a minute, don't pull out yet." And he worked with him, and he was able to play. And I don't even know how well he did, but he played, and he can. He says that it's because of Pete that he was able to continue to play golf.
Wow.
There's a lot of famous athletes that do Egoscue. In fact, many of you may have heard of Bethany Hamilton. She is the one who lost her arm to a shark bite.
Right.
She was a surfer. She does Egoscue to keep her body balanced, because once you lose a limb, your body's going to continually be prone to imbalance. So it's one of the things she does to help keep her body balanced and keep surfing.
Wow, that's great stuff. Do you work much with physical therapists? Do they ever use this Egoscue method?
Well, I don't work much with them. I can say that one of my clients is a physical therapy assistant who she's wonderful, and she actually promotes and utilizes some of this. She's not certified in it, but she utilizes some of it, and she talks, refers people to it. There are some physical therapists that are certified in it, but none around here that I know of. Some are starting to use it. It's been slow in coming out because Egoscue doesn't advertise. He basically, the philosophy is we help one person at a time, they get better, and they tell other people. So it's word of mouth. It's spreading from California. It's taken a long time to get here.
Okay, well, it's getting here, and that's what's important,
That's right.
And you found it, and now
That's
you're
right.
You're telling us about it.
That's
Yeah,
right.
yeah.
I'm spreading it.
You're spreading it, so you're doing your job. So we've got a couple of comments
Okay.
from folks. Stacy, it looks like you were able to log on, so I'm glad Kristen helped her out. Thank you for that. Leslie, when we were doing the exercises, she said, "Do your fingers have to be clasped together?"
Clasped.
I don't know when.
Okay, well.
When I guess maybe when we were doing the one with the hands over the head.
Yeah, with the standing overhead extension, you want to clasp your fingers together, hold like you're holding hands with yourself, and then you push them palms out and lift them over your head. Now there is an exercise where you just yoga, where you just lift your arms straight up, and that's a great stretch, but it's doing something different.
Okay, Leslie just checked in again and said her question was in regard to the exercise with arms outstretched.
The arm circles. Okay, we're doing the golfer's grip. So the fingers are curled in to the pads of your palms, the tops of your palms, thumbs out, but your hands are out to your sides, like in the I can go back to the photo.
Okay, that'd be helpful.
There we go. So your arms are shoulder height out to your sides, like in the two big pictures there.
Okay.
So, and we were trying to do the work with your shoulders. So a lot of people really kind of try to do them, with their, like, swinging their arms around, but the movement should come from the shoulders. But if your shoulders are really tight and don't have a lot of good range of motion, that may be hard to do. But, we start with what we can do, and
Right.
as we do them, it quickly changes.
Right, good. Okay, Stacy made a comment, I guess, when we were doing the exercises. She said she found one shoulder won't go back.
Okay.
Yeah, I'm sure I don't know if that's common or not.
Well, and I'll say something to that.
Yeah, go
quickly. Ahead. If that's the case, then we would probably, if one shoulder's not going back, I would not give you that exercise. I would give you something that we could do. That the key with these exercises being effective is to get your body in a good aligned position with whatever we're doing. So we may at first possibly avoid certain exercises for someone that their shoulder's stuck. We may work more with the lower body, and that's going to positively affect the upper body.
Right. And so it's not a one size fits all. You kind of customize the exercises for the patient, the client.
Absolutely. Very much. It's very individualized. We listen to our clients and we work with them. That's why it takes time, because it's not just, I don't just spit out, oh, well, here, just take these 3 things home. They work for everybody. Okay. No, because, we need feedback, and the feedback of our clients is so important. So it's really, we're working together. And what the client has to say and what they're feeling is so important. Right. So we really tap into that and help, we're partners, really.
Yeah, it's great. Donna asks, do you come to homes for one-on-one?
I have not. I do not typically.
Okay.
If there was, I would potentially entertain that idea if it was a need for it. I would so you can check with me if that's a need. Yeah.
Have Donna contact you.
Mm-hmm.
Okay. Christine asks, does insurance cover this?
Not that I know of. It's much like chiropractic was years ago. I do the thing, I can't think of what it is right now, where, the account, the healthcare savings account, I
The
think.
claim form? Oh, okay. Like a
The
health savings account?
Yeah, that people can use it for that. I was actually told, and I have to figure out how to kind of let people know this. I don't actually have insurance. I have healthcare sharing, Samaritan Ministries. And they told me if a doctor recommended Egoscue therapy, they would pay for it.
Oh,
Okay.
wow.
So, but insurance companies, I recommend for people who are interested to submit it to see, but to my knowledge, no insurance companies cover it yet. And it's a
Okay.
shame because it's so effective.
No, but you did say yet, so
Yet,
I
yeah,
could see this
I
being something that,
expect,
yeah, sure.
absolutely, I expect that one day it will. Hey, healthcare sharing, my healthcare sharing said they would cover it, so
Yeah,
it's coming.
just a matter of time. Yep,
Yeah,
that's right. Kristen asks, should the E sizes be done daily?
they should.
Yeah.
We're changing the muscle memory. What I tell my clients is preferably daily. Okay, 5 to 7 days a week is definitely optimal. If you do it less, you're still going to get some benefit, but it's not going to be the same. It really isn't. I
Mm-hmm.
do have some people I've worked with that use it as a pain relief thing. They won't do it daily, but boy, when they have that pain, they do it and they get their relief.
Mm-hmm.
And that's okay. And if that's all you want from it, great, that's fine, because that's where you are.
Right.
Um, but so it's whatever you want it to be. But if you really want to change your posture to such that those pains don't keep coming back, you'll want to do it probably 5 to 7 days a week. Less than that, really, um, if you go more than a couple of days, muscles just don't, they start to atrophy. And so you really need to not skip more than,
Yeah. So
more than you do.
it works when you work it.
Yeah, you get out of it what you put into it, really.
Exactly. Yeah. Right.
Absolutely. I mean, if you are a member of a gym but you don't go to it, what's it
Doesn't
gonna,
do you
nothing. It doesn't do. And if you get these tools and you don't do them, they're not going to work.
right, right,
Yeah.
right. Maria is copying the and sharing the some of the, like Dr. Axe's article and some of the
Sure.
resources you had put on. And Donna says, thank you, this is great. Tracy Foster says, I was a friend of Deb's first, and then I became a client. These exercises helped me with chronic tailbone pain after multiple injections didn't help. This totally works, but you have to do it regularly. She's
Hi,
saying what we were just saying.
Tracy. Thank you.
She says, I'm doing mine now as I was listening. Thanks, Deb. And Nancy, somebody else said, Michelle said, never knew this even existed. Thank you. And Nancy said, is it really expensive? Do you ever have specials or discounts? I don't know if you would address that.
Right. I give a discount for, I currently have a 4-session package with a 10% discount. The pricing may change up or down. I've changed it already a couple of times since I started. I can tell you what I charge per session, and given that the first session's 3 hours and follow-up sessions are typically an hour and a half to 2 hours. Again, sometimes more. I usually like to leave time in case we need it. I charge individual session $175 and 4-session package is $630. That's my current pricing. Now, if you're listening to this audio later down the road, that could change. But at this moment, February 22nd, 2017, that's where I am.
Okay.
Every affiliate, the clinics charge differently. Different affiliates like myself get to choose their pricing, so it'll be different everywhere you go. How much time they spend with you, what you get at each session, and how much you pay. So feel free to look around and see what works for you. And a lot of it too is personality. I may not be someone's cup of tea, and that's okay.
Right.
There's great therapists. There's a clinic out in Fort Washington, Pennsylvania. It's like an hour from me, but maybe that's closer to some people who are here. And Joan and Fran are great.
Okay.
One of my clients, she's going to get certified. She's going to be up and running, and she'll be in the South Jersey area at some point. And I know she's going to be great.
Well,
So,
that price sounds very reasonable to me for what you're offering. Personally,
well,
I think
thank you.
it's a very fair price. So, Deb, we're going to wrap this up. I really thank you for taking the time, putting together this great PowerPoint that was so informative, but also just really to the point, to show us these simple exercises, or not so simple, but I could say that, things that people can implement. And that
Absolutely.
makes all the difference. So thanks for taking the time, and continue with the work that you're doing. We appreciate it.
Thank you, Alicia. Thanks, everybody, for joining.
Yes. So thank you, everybody, for being here tonight. I'm just going to give you a quick rundown on next month's speaker. The March webinar will be on March 22nd, and we will be having Mark Butler, who is a physical therapist, a board-certified orthopedic clinical specialist, and a McKenzie certified specialist for mechanical diagnosis and treatment. He'll be discussing graded motor imagery for the treatment of complex regional pain syndromes and some other chronic pain syndromes. As you know, your confidence in us is our highest compliment. If you found value in these newsletters, the webinars, and the services, please consider leaving us a positive Google review. Once again, thank you, Deb, and thanks for all who were joining us this evening. Everyone, have a good night. Take care.
And good night.